Hello and welcome. Ahead of our annual general meeting, we invited members of the public to submit questions about local health and care services. I'm Jason Stamp, Acting Chair of NHS Humber and North Yorkshire Integrated Care Board, and in this short film I'll be putting your questions to Teresa Fenwick, our Acting Chief Executive. Thank you to everyone who got in touch. We hope these answers are helpful and provide some practical information. Let's get started. Teresa, we've had a question around Bridlington and health inequalities. The question is, now that the national government is committed to reducing health inequalities affecting coastal towns, how will the ICB ensure that healthcare services are improved locally for the seaside town of Bridlington? And Bridlington, of course, is the largest East Yorkshire riding town with the greatest concentration of deprivation within the East Riding.
Yeah, thanks, Jason. That's a really important question for that very reason. We do know that it faces the highest levels of deprivation in the East Riding. And furthermore, the town overall experiences some of the poorest health outcomes in our region. That's not unique to Bridlington. It is unfortunately something that we see in many coastal communities across the country, and why there is the national focus on it. Over recent years, we have actually worked with local partners to make some real progress. And one of the biggest steps has actually been in reorganising primary care in the town. And what were once 6 small and fragile GP practices have been brought together into 2 larger practices that makes them much more sustainable. That's already improved access and quality, especially in the practice run by Doctors Reddy and Nunn, and that's seen real improvements overall. To support that change, we've also introduced temporary solutions like extra clinical space using porta cabins where that's needed. And longer term, we're working with partners to explore opportunities to develop a health and care campus in the town centre. We're also seeing more joined up care locally. Mental health and community services are better integrated, and that's thanks to the development of the neighbourhood team and also access to the talking therapies in Bridlington, which is now at or above national levels. Within the East Riding of Yorkshire, overall we've set up dedicated Bridlington work streams as part of our place-based health and care strategy. That's actually helping us to focus on priorities like public health, stronger primary care, better access to diagnostics and rehabilitation, and more support for palliative care and community mental health. There's also, though, a growing recognition that we need to do more for children and young people, especially in the early years of life. And last year, we carried out a community conversation in Bridlington to better understand people's experiences and priorities when it comes to health and care. The insights we gathered from that work have led to the development of a co-produced plan with local partners. We've now begun implementing that plan and will continue working alongside the community to improve access and outcomes. We know that there's a lot of public interest in the future of Bridlington Hospital, and that's understandable and perfectly reasonable. But I would like to stress that actually we know that improving long-term health outcomes depends on much more than hospital care. Health is much more than a hospital. It's also about prevention, managing long-term conditions well, and making sure that everyone has fair and access to support.
So the next question is I'm hearing a lot about community diagnostic centres. What are they and how can I access them?
Okay, so community diagnostics centres, or CDCs for shorthand, they're facilities designed to make it quicker and easier for people to get the tests that they need. So you need to think of them as one-stop shops for checks, scans, tests, all in one place and closer to home. Instead of having to go to a large hospital some distance away, you can be seen in your local community. That means shorter waiting times, fewer journeys and faster results. Here in Humber and North Yorkshire, we're investing around £80 million in these centres, and once they're fully up and running, they'll deliver up to 900,000 extra tests, checks and scans every year. Each CDC is staffed by expert clinicians and aims to offer as many tests as possible in a single visit. That not only speeds up diagnosis, but actually makes the process much more convenient for patients, especially if you need more than one test. In terms of access, your GP will still be the first point of contact. If they think you need a diagnostic test, they'll refer you, and the CDC team will then be in touch with you to make an appointment. We already have CDCs open in several locations across our area, including Askenbar near York, Selby, Ripon, Beverley, Scunthorpe and Grimsby. A brand new CDC is about to open in Hull City Centre, and another one is coming later in the year in Scarborough. So whether it's a scan, a heart check, a blood test, CDCs are about bringing vital diagnostics closer to home, helping people to get the answers that they need sooner.
So unsurprisingly, Teresa, one of the questions is about NHS dentistry. And the question is around somebody who cannot find an NHS dentist in their area, and actually what can they do about that?
Okay, thanks, Jason. I think we do need to recognise that this is particularly difficult at this moment in time, and I know how frustrating and challenging that can be for individuals that need dental support. So what I would say is if you do have an urgent dental problem like severe pain, swelling or trauma, you can call NHS 111. If it's clinically appropriate, you'll then be offered an urgent appointment. But people may actually have to travel to be able to access that urgent appointment, but appointments are available across most areas. In the meantime, we must also emphasise the need for good personal dental hygiene, helping to keep your teeth healthy until you can get the care that you need.
So the next question, Teresa, is around support available in York for people with osteoporosis or at risk of fracture. So it's the whole frailty piece.
Oh, okay. So obviously the ICB supports the early diagnosis and ongoing management of osteoporosis, which is primarily provided through GP practices in York, because that's where osteoporosis is treated mainly in primary care. GPs can give tailored, so specific to individual patients, advice on diet, exercise, lifestyle changes, and obviously they monitor patients over time. But also patients can be referred to other services if that's needed. Since 2012, GP practices have been incentivised to deliver these services under an arrangement known as the National Quality Outcomes Framework, which we shorten to QOF. That's to maintain a register of patients with osteoporosis, particularly those who've had a frailty fracture. That encourages structured case finding and prevention of further fractures. In York, there are currently over 4,000 patients on that register. That's 4,000 patients with an active diagnosis of osteoporosis. And in 23 to 24, GP practices across the city achieved 100% compliance with the Quality Outcomes Framework osteoporosis indicators, which demonstrates a strong local delivery of all the requirements around the osteoporosis service. To further reduce the risk of injury, however, City of York Council also offers a falls prevention scheme, and that includes a free home assessment with personalised advice to help people stay safe and steady on their feet.
Thanks, Teresa, and thank you once again for the question you've submitted. If there are any other questions you have for us, please do not hesitate to submit them via the link that is on the screen now. Thank you once again for all of your support.